My name's Josiah Northern. I'm a firefighter paramedic with the Castle Rock Fire and Rescue Department. Today we're going to be going over the scenario of helmet removal. First and foremost, you want to make sure you have your body substance isolation precautions on. You can come into the room wearing gloves and eye protection, or you can verbalize that for this scenario. When assessing the patient's airway, there are 3 specific reasons we need to remove a helmet off of a patient. Number 1, if we need to manually open the patient's airway using a jaw thrust maneuver, or for some reason or another we need to suction the patient's airway. Number 2, if the patient has an altered mental status. And number 3, if there's any uncontrolled bleeding that we'll need to stop. So the first thing we'll do, my partner Adam will come in and maintain a neutral alignment of the head and neck and also take manual C-spine precautions. At this time, I will assess sensory, motor, and neural functions. Squeeze, check pulses, pulses in the feet. Once you've checked CMS status, we're going to remove the straps. Adam's going to move his hands down so that he is controlling the helmet and also the head and neck. By pulling the helmet away from his face, I'm going to use a rocking motion to get the helmet off while Adam supports the patient's head and neck and keeps it in an inline position. And that's how you remove a motorcycle helmet. We're going to move on and show you how to remove a helmet and shoulder pads from a sports injury. Adam's going to maintain inline stabilization of the C-spine as well as his head and neck. After undoing all the straps, the chin strap, we want to remove the face piece as well. You may need a screwdriver to do this, and you'll also need to cut any laces or straps on the actual shoulder pads themselves. So with Adam supporting the helmet, the head, and the neck, I'm going to come in, place my hands in between the patient's head and the helmet, using a rocking motion, remove the football helmet. Adam's going to continue to support the head and neck and keep his C-spine in as neutral position as possible. Next thing we'll do is we'll remove the shoulder pads off of the patient to make sure we're maintaining that neutral stabilization. Select the appropriately sized C-collar and apply that onto our patient. Pad any voids as necessary. Move the patient over to a long backboard. And last but not least, make sure you reassess your CMS neuro exam. And that's the removal of a helmet and shoulder pads from a sports injury.